So, for my third question, we have a feature where the patients will be able to get their test results and diagnoses, but we're having trouble having the trying to measure how much how detailed the data actually needs to be for the patient to easily understand it and at the same time be useful enough for the patient. So my question is, how detailed does the data we provide the patient need to be?
Okay, now even at this time and age, we do provide patients with their images, yeah, images such as X-rays, CT scans, MRI scans, and also we also provide patients with their blood test results, urine test results, and things like that. So to a certain extent, those can be digitalized, where we can get access to results online. But then certain confidential results maybe might be you can restrict those, such as maybe testing for HIV, yeah, testing for sexually transmitted diseases, can be confidential and only accessible when they visit the doctor, for example. Test of biopsies to detect cancer, you know, where it would be better to be sitting down with the doctor to explain the results rather than just the patient getting the result and being shocked by what they may see and read. So you really need to sit down with the doctors and uh, filter what can be seen by the patients and what needs to be actually discussed with at the doctor's office.
Right? So sensitive data can cause an misunderstanding, would you say?
Yes, and also data which are more technical. Yeah.
Uh,
Okay.
okay. So what about the other side? We have a feature where the doctor would be able to make a remote diagnosis where they'll get the data from the medical center and maybe not for complicated inflictions, but maybe for simple stuff. So what would the doctor need to actually make a proper diagnosis?
Well, being digital, you can work on symptoms. Symptoms are more patient complaints, what they feel, what they experience, things like pain, dizziness, what they can see on their body, such as rashes, blemishes, bruises, things like that. So symptoms, yes, and also certain signs. Yeah? Signs ni are things like pulse, yeah, the heart rate. Maybe now we can also link that with the blood pressure, a lot of home monitoring of blood pressure, temperature, yeah, some of these objective signs, we call it, which are uh, the input into this app. Now, with certain signs and symptoms, sometimes we can already make a diagnosis. Yeah. So again, for simple things, we can make a simple diagnosis, and further information and diagnosis, then they would need to go to the hospital. Yeah. So sometimes we need to do imaging, such as ultrasound, X-rays, scans, and sometimes we need to do actual blood tests. Yeah, where we need to take a sample, also urine. Sometimes we need urine samples, and sometimes we even need to go to the extent of taking a biopsy, yeah, where we take a sample of tissue. So up to a certain level, yes, simple diagnosis can be made digitally, but the rest, you still need to go to the hospital. So again, yeah, to develop this app fully, you need input from the doctors. Yeah, so we do have actually, yeah, some nurses and doctors who are digitally savvy, and these people can help actually develop this app and what needs to be put in to this app and to what extent, yeah, uh, we can make a diagnosis. So some simple things that we can achieve actually through apps is medical advice and medical opinions rather than maybe reaching a final diagnosis. Yeah, sometimes the signs and symptoms we can just advise or give an opinion uh, digitally, such as you can just take a bath, or you can just take two Panadols and go to bed or get a good rest or something like that. But then certain things we need to say, or you need to go and see the doctor. Yeah, because the examination of the patient plays an important role of making a diagnosis. Yeah, especially in some more complicated situations.
Right.
Okay.
So that's more to for patients that are first timers. So for patients that coming weekly, checking their symptoms often, we are considering doing between a patient diary where the patient logs in and types like manually their conditions throughout the day, and a patient self-diagnose where the patient is given a set of questions to check his symptoms. So what would be more appropriate and lessen the user error, I guess? Yeah.
Um, well, for continuing patients, patients with continuing care, for example, a simple example would be diabetics. If a diagnosis has already been made that this patient has diabetes, then we just need certain data to monitor, yeah, until we see the patient again. So blood sugar, for example, can be monitored in the house. People with hypertension, yeah, high blood pressure, they can also check blood pressure at home. So with certain data, yes, they can put it in a diary, and this diary should be accessible to the doctor, treating doctor as well, and we can advise changes in medications, or and that's the main thing, I suppose, changes in medications, how to adjust the medications, for example, in diabetics, whether they should increase or decrease the dosage of medication, or injections that they need to use. So yes, a patient diary for follow-up patients, yeah, for patients who have ongoing care, would be very useful. This would reduce the number of times they need to go to the hospital, and it's also more convenient for the patient, where they can actually get an update of what to do even in their own homes. So that would be the thing that would be useful, and things that we would like to see actually in these apps.
So would you say one is better than the other, or are they providing completely different things?
What do you mean by
The two options between a patient diary and a set of questions where the patient is asked.
both? I think a combination of both.